The healthcare debate is at a fever pitch in our nation's capital. One senator is proposing a compromise between private and public health plans. Peter Cook is standing by with the senator on Capitol Hill. Peter.
Well, thanks very much, Deirdre. I am joined by North Dakota Democratic Senator Kent Conner. He's the chairman of the Budget Committee, member of the Finance Committee, and someone who's trying to craft an alternative, if you can, to this idea of a government-run healthcare option. First of all, Senator, thanks for the time. Appreciate it.
You bet. Good to be with you.
Tell us more about this idea for nonprofit co-ops at the state level. Is this, in your view, the best and only alternative right now to try and get a bipartisan deal?
Well, I don't know if it's the only, but right now I think it's the best. And what it tries to do is split the difference here. Those who want public option typically want it because they want competition for the for-profit private insurance companies. Cooperatives can do that. On the other hand, there's another group that are adamantly opposed to having a government-run alternative. And this is not government-run. It's membership-run, membership-controlled. So it does represent a real compromise.
Does it represent the kind of program you think that's actually going to achieve the goals that the president set out to cover the 50 million or so Americans who right now aren't covered, and also bring down health care costs? Because, you know, critics say it's just not going to be big and powerful enough like the government would be.
Well, I think it's very important to understand there are other provisions in the bill that are going to help expand coverage to the some 46 to 50 million that don't have coverage now. What the co-op option provides is a choice for people who are going to get that expanded coverage. So they'd be able to choose this option, or they'd be able to choose private for-profit insurance companies for their coverage, or they'd be able to stick with the coverage they've got. All of those would be open to them. The nice thing about a cooperative plan is we know it works. It's worked all across the country. You know, the Associated Press is a cooperative. Ace Hardware is a cooperative. Land O'Lakes is a cooperative. We've got major healthcare cooperatives in this country that have been very successful. So it's a model that's proven and it's been successful.
You've also had healthcare cooperatives in the past, and they have been tried over the decades. Not all of them have been that successful. Some have failed to make the grade in terms of keeping costs down, serving people with quality health care. The historical perspective cuts both ways, doesn't it?
It does. I mean, that's a fair comment. But remember, that's in an unreformed insurance market. It's really quite remarkable that anything has succeeded in an unreformed insurance market in terms of providing a competitive model. So what the actuaries tell us is with the reforms that are in other places in this bill, coupled with all the new entrants, more than 40 million people that will be coming into the market, this model, this cooperative model, would work quite well and be successful, would help hold down costs. You know, if you look at the cooperative model out in Washington, covers 600,000 people, has the highest satisfaction ranking of any insurance delivery system in the market. So part of the reason is the membership is very engaged when they own it and they control it.
How much is it going to cost the federal government to get these co-ops off the ground?
The initial estimates, Peter, are $3 to $4 billion nationwide, and the idea that we have is there would be a national structure with state affiliates, and those state affiliates would have the ability to regionalize where that makes sense. For example, in my part of the country, our pool would not be large enough to be able to have success in negotiating with providers. So, because we only have 640,000 people in my state, we'd need to join with perhaps South Dakota and Montana. So a national structure with state affiliates and the ability of those state affiliates to join regional structures where that makes sense.
What about the notion, Senator Schumer and others have talked about this, you've talked about this as well. How about a national co-op and achieve the same goal?
Yeah, we do see a national structure, a national cooperative with state affiliates and the ability to regionalize. Why the difference? Well, you need a national structure in case some states don't provide the alternative, and you also want that purchasing power to be national, because that will help hold down cost.
You're going into the Finance Committee, more talks behind closed doors on your bill. The only bipartisan negotiations taking place on the Hill. What are the chances for success of this right now?
You know, I'm always reluctant to try to foresee the future, but I think right now my option is the only one that is attracting any significant Republican support. And if we want to have a bipartisan bill, we've got to find ways to bridge differences here.
You think President Obama could agree to this?
He said very flattering things about it last week in an interview. He said it was a creative idea, that we needed to make certain we pay attention to options that are being offered like this one. So I hope everybody won't, at this moment, draw lines in the sand. Let's everybody have a chance to fully analyze all of these options and then put together the best package.
All right. Senator Ken Conrad of North Dakota, we appreciate the time. Thanks very much. Deirdre, that is potentially the middle ground compromise being discussed here on Capitol Hill. We'll send it back to you in New York.
Peter, thank you very much.